Thank you so much, Steph, for inviting me to come and speak to the Tiger Group today. I really appreciate the opportunity to talk to you about BRAN, what even is BRAN, and how that relates to consent. Before I start, I do have a declaration of interest. So I'm employed by a company called Radar Healthcare, and within Radar, there is a product called IDO, which is an information library for patients to support them making informed decisions about their care, mostly around surgical procedures, as well as some diagnostic tests and investigations as well. And those are used in shared decision making and on consent forms. And I am also a volunteer for the PIFTIC steering group, so that's a patient information forum. And the reason I've mentioned that is I do talk a little bit about PIF in my presentation, so just to make everyone aware of that. So first of all, what is BRAN? So it's an acronym that I don't expect everyone to be familiar with or to understand from seeing it straight away. I work with health professionals pretty much all day, every day, and often they'll ask me, I'll go wittering on about BRAN and they'll say, hang on, what does BRAN mean? So I absolutely don't expect people to know what that is first off. So it really is essentially the way that information can be structured to help us to make decisions about our care. And you can see there, it stands for the benefits, the risks, the alternatives, including doing nothing. So that's all the information that can help us to make a decision. And it's often abbreviated to BRAN. And so when is it actually used? So you'll see it often on consent forms, but it will also be used in those conversations as well. It's absolutely not limited to written information. Because of my background, I will kind of be referring to it quite a lot in the context of written information, but it's really important to remember that BRAN can be a process of a conversation as well, an interaction with your healthcare professional about the procedures that are being recommended to you. So it's used for that shared decision-making process, and mostly you'll see it if it's a procedure or an investigation that comes with any kind of significant risks or alternatives that are available. And mostly it will be seen, especially in written form, on elective procedures. That's the procedures that are planned. Also emergency as well. So there are some emergencies where there still will be time for that consent process. And where possible, healthcare professionals will always try to take consent when a patient is competent and capable of giving their consent for that. Again, diagnostic tests, so hysteroscopies and colposcopies are good examples where you'll see it, and then some other areas as well. Not completely restricted to those, but those are the most common areas within healthcare that you'll see BRAN be used. BRAN is not a legal requirement of informed consent. I think that's a really important point to make. It is a really useful tool that can support patients and healthcare professionals, again, to make sure that it is a shared decision within that process. And it's really evolved over time as a result of some case law that I will talk about briefly as well, but it's not a legal requirement. So if BRAN isn't a legal requirement, what is? So there are three core criteria which we need to make sure are met before we can say that someone's given their informed consent. So it has to be informed, and that's kind of the main of these three that we'll talk about today, because it is about giving the patient enough information to make a choice that is the right choice for them, not just the right choice necessarily from the perspective of the healthcare professional or anyone else. It has to be voluntary. That seems obvious, but some people may feel that there has been some coercion, some pressure, some guidance from the healthcare professional that goes beyond that kind of supportive care and is more kind of pushing them into that decision. And the patient has to be competent as well, and they need to be assessed as capable to understand and decide that decision. And just a note on competency as well, that can change. So we can be competent, over the course of a year, it can change. Over the course of a month, it can change. It can change over the course of a single procedure or a single session with your healthcare professional as well. So your healthcare professionals should always be assessing your competency to make a decision. It can be impacted by things like if you are in extreme pain, or if you're in distress, if you're in shock, if you've been sedated. So healthcare professionals have to be really aware that every time a decision is being made, the opportunity to take consent has been taken when it comes with those risks and alternatives as well. And if a patient is deemed not to be competent, then there are more decisions that have to be made about the next steps for their treatment. If any of these are missing, the consent is not legally valid. That's a really important point to remember. And that's why, again, we come back to that first point, the informed, that importance of that BRAN. So I'm going to quickly talk now about the history of how we've come up with BRAN, or how BRAN has evolved over time. So I think most people, especially healthcare professionals, will be familiar with Montgomery. Montgomery was a really key case in influencing how we how patients are supported to make decisions. So in that case, it was established that doctors have to take the care to make sure patients are made aware of any risks and reasonable alternatives that are significant to the patient. So it's not just the doctors. So historically, the doctors would decide what the patient needed to know and then give them that information for them to make the decision. So it shifted the process away from something called the Bolam test, which was when healthcare professionals would be expected to consider what other healthcare professionals with similar expertise and background to them, what decisions they would make about and for that patient. So that's shifted towards the patient making that decision. There was a case more recently that I think it's worth mentioning, and again, if you're interested in this, you can go and have a look online and read more about it, that actually established that while consent should reflect what matters to the patient, there is still that professional judgment that can be exercised and should be in deciding which options are reasonable, not just the theoretical options, but the practical options that are reasonable based on the information that the clinician has in front of them and based on, you know, any of the history that they have about that patient. So I thought that was just worth mentioning and worth looking into. You know, if anyone's interested in looking into that further, then, you know, you absolutely should. And then guidance, again, that's something else that is important to the BRAN process. And I've just put some quotes there from the GMC guidance. It was updated in 2020. So you can see I've put in bold what's most important. And on that last point, in the GMC guidance, I think it says harms instead of risks, but it's essentially the same thing. So you can see again where that BRAN is coming from. Make sure that that patient has the information about benefits, risks, alternatives, and the options of taking no option. So that's kind of the history of where BRAN came from and how it does tie into that legal process of consent. So I'm going to talk about the BRAN of BRAN. Hopefully it's a helpful way of us understanding why we use BRAN and how it helps. So benefits of BRAN, the most important words on this slide are those top three words, if done right, because there isn't an absolute equality of BRAN available, but if done right, there are huge benefits to BRAN to patients and to healthcare professionals as well when it comes to procedures. So it educates and it empowers us to make a decision. If we've been told that we might need quite a serious or an invasive procedure investigation, if we've been experiencing symptoms that are giving us quite severe pain or they're making us very worried, then we feel particularly vulnerable. To then have to make a big decision about a procedure is even harder than if you're making a decision when you're feeling completely normal and well. So using BRAN, it really helps to filter out all of that noise and to focus in on that decision. It's evidence-based, if done right. It's not Dr. Google. It's not the AI summaries that we're all now used to seeing on Google that have come under, you know, lots of criticism. It's not that well-meaning but ill-informed advice that you might come across from a neighbour, a friend. And it's not mis and disinformation. So it's that safe place of information that can help you in the time when you're feeling under particular pressure. It can be personalised, again, if done right. What matters to you, not just the BRAN for everyone, but the BRAN for you. What pre-existing conditions do you have that affect your risk rates? What previous experiences have you had? Again, this is really important when it comes to gynaecology, because for many patients, there will be experience, whether it be within the healthcare space or elsewhere, that impact how they approach these kind of investigations and procedures. And BRAN can take that into consideration if done right. It avoids that paternalistic approach. So again, we absolutely have to appreciate the expertise and the experience that our healthcare professionals come with. That's the whole point. That's why they're offering and explaining the treatment and delivering it. But it really is that shared decision making where the patient gets to decide, regardless of what the doctor or the healthcare professional is advising. It's not the doctor's choice, it's the patient's. And it also supports healthcare professionals. It gives them that framework to ensure that that is truly shared decision making. And I have seen BRAN consent forms being used in evidence in cases of failure to inform to show whether or not they feel that courts feel that that patient was truly informed. So the risks of BRAN, so it can be inconsistent. So this is where I talk about the patient information forum. If you're a patient and you're being given information, I'd really encourage you to look for the PIF tick. So the PIF tick is a certification that PIF provide to healthcare information producers if they adhere to certain processes and approaches to creating that information, and that those processes are reviewed every year. So it's not just they get the tick and then they can go out and spread that information. They are constantly being reviewed and assessed. However, if we talk about all information being equal, if all the information is presented in the same way, there is a risk of inequality. Has there been a consideration for digital and written literacy? What about our cognition levels? Is it written in our first language? And what about learning disabilities? Is it accessible to us depending on our different needs? And if everyone is given the same information, then that is not the case. It can be too rigid and not give enough detail. BRAN can be great to help us make a decision, but what about what happens before the procedure? What about recovery? How is it going to affect your life afterwards? Those considerations are going to be really important when you're making a decision. It can be a tick box exercise, quite literally, and we hope that it's not, but there are cases of extremely busy organisations and clinics and healthcare professionals, and it can be something that is just, yeah, we've done that, we've ticked it off, what's next? So, that can be a risk of going through an established process in that way. And again, really important to gynaecology, it might not be trauma informed. So if it's just the same kind of copy and paste BRAN given to everyone, is it taking into consideration the different personal life experiences that are being brought into that conversation? Alternatives to BRAN, like I said, it's not a legal requirement. And so that means that depending on where you are, what trust you are, you're living within that catchment area of, what clinic you go to, whether it's a private hospital, NHS, there's no guarantee that you're getting the same level of information as each trust or each site is responsible for sourcing that information themselves. So you may get it in a slightly different way. Decision aids as well, some people might be familiar with decision aids. So those help guide you through that process of, if you make this decision, you might go down this path. If you make that decision, it might be a slightly different path. They're really useful, actually. They're fantastic when done right and when done well. But they are not they're not a viable alternative to BRAN, but you might see those coming up a bit more, I think. And then finally, of course, what happens if there is no BRAN? So that's the doing nothing. So failure to provide adequate information when obtaining consent from a patient can result in a civil claim for negligence, first of all. So for healthcare professionals, that's really important. But for patients, of course, if you're not truly informed, you're not making an informed decision. If you're not given the information in a format you understand, in a language that you recognise, how can you make a decision? So the Montgomery case is a good example of that, where Nadine Montgomery was not given all of the information that she needed to make a decision about her care, and as a result, she had complications that had serious health implications on the baby that was born through a vaginal birth, and that was really pivotal in that Montgomery ruling. Trust between the patient and the healthcare professional can be damaged as well. That's a massive thing. That's a massive risk. If a patient doesn't feel like they made a decision that was right for them, or if they felt like it was rushed, or they didn't have all of the facts available to make that decision, and then especially if something does go wrong or they have a bad experience, then how can we expect them to go back again and go have more procedures and more investigations if they've had that bad experience? So, the damage that can be done to a patient through a lack of BRAN or a lack of good information is really quite serious. And like I said at the top of this slide as well, that legal aspect of it is important, especially in a civil case. So failure to inform can be brought against healthcare professionals or trusts or organisations if they don't give that patient all of that information. And that can have really, really serious consequences, whether that be legal, if it goes that far. It might be financial in terms of damages, and also professional. So we have had clinicians being struck off the register for not taking properly informed consent. So that's what happens if there's no BRAN. That's my kind of whistle-stop tour of BRAN. Like I said, I'm not a clinician, so I can't answer questions around the clinical side of things, but happy to have conversations about informed consent, about patient information. My contact details are on the screen, and I will hand over to Steph. Thank you very much.